Hi guys, it's Kendra. So my topic's on liver cancer and how to prevent it as a 17 to 21-year-old. So I'll just go through a quick presentation with some tips here. Basics of prevention. Of course, prevention for every kind of cancer and for a lot of other health conditions as well include regular exercise, healthy weight, healthy diet, um, and specifically for this liver cancer, limiting the intake of alcohol, avoiding hepatitis B and C infections, and reducing cancer-specific risk factors, which I'll go through in a minute. So, healthy lifestyle, including exercise and healthy weight. The American Cancer Society recommends at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise every week, or some kind of combination of these. So, that's walking for like 20 to 30 minutes every day at a moderate pace, or doing some more intense exercise less time per week. And obesity has been seen to increase the risk of many cancers. So, as young people, it's important to set up a lifestyle of a healthy diet to benefit a healthy weight. And I'll go through a little bit more on diet in the next slide. So, there was a study done on specific foods that could help contribute to lowering the risk of liver cancer specifically. And this Zhao et al. Was done in 2016, and they found essentially it's fruits and vegetables and then some kinds of like spices or other types of foods can really decrease like the inflammation process, and some of the antioxidants are just really specific to liver cancer, which is really interesting. So creating a diet that's full of grapes, black currants, plums, broccoli, cauliflower, and then including things like garlic, pepper, and ginger can decrease the risk of liver cancer. So, hepatitis is the most significant risk factor for liver cancer. There's hepatitis B and hepatitis C, and both of those are the big ones for liver cancer. So, young people, 17 to 21, it's kind of starting to party, kind of can have like some risky lifestyle choices, and going about doing things carefully, especially like using condoms during sexual activity and not sharing needles if choosing to use drugs, can really decrease the risk of contracting hepatitis B or C. And that's it, pretty much. I'll link my little pamphlet in one of the comments. Thanks, guys.